Hello, Namaste. I welcome you all to this session number 22 of Gurubodha series led by Guru Raja sir. I cordially welcome Dr. M.B. Guru Raja sir to this class.
Thank you, Dr. Dhanajan.
So this is Gurubodha session number 22 with Dr. M.B. Guru Raja sir. I am Dr. Janardana V. Hebbar, founder of EasyAyurveda.com. Dr. M.B. Gururaja sir is an Ayurveda professor at Bapuji Ayurveda Medical College, Shumoga, and he practices at Davala Pentacare Ayurveda Treatment Center and Davala Ayurvedic Clinic in Shumoga. And he can be contacted for guidance or consultation at easyayurveda.com/Guru Raja. And this is a session is both question and answer type. This is kind of an open-ended discussion. It's not really kind of teaching way of method that we follow. This is called a YouTube playlist. So here it starts with Gurubodha session 1. And if you can see on the right side, the short clips of Gurubodha 1, 2, 3, 4, and the long clips, the 50-hour clips, 50 minutes clips, sorry. So all those things are available in one place here. And so coming to the topics for today, in the last class we were discussing about Prameha or diabetes due to Vata, Pitta and Kapha, and Vataja are considered as Asadhya, whereas Pittaja Prameha is considered as Yapya, Kaphaja is Sadhya. There's a little confusion for one of the attendees. They're saying that you have mentioned that diabetes is due to Vata dosha aggravation, but foods like Bittergourd, neem, which increase Vata dosha, are also good for diabetes. So how to decipher it? Gururaja sir, can you please throw us some light on this?
See, first, for a time being, to understand that what is Prameha and what is Madumeha and what is diabetes. If we keep these three words, Prameha means in Ayurveda very clearly said something which is required to the body is being thrown out of the body through urine, and that is what I have explained as that is a kleda which comes to basti and goes out of the body, which is actually required to the body, but it is going out of the body. So this is what the explanation is given in Ayurveda. And without the anubandha of kapha, you cannot expect that prameha will take place. In prameha, anubandha of kapha will be there. Along with that, other dominantly participating dosha will influence the nature of the prameha. If it is totally kaphaja dominant, then we may have 10 varieties of kaphaja pramehas, but if it is 6 varieties of pittaja dominant, in that it will be involvement of kapha will be there, but along with that pitta is also there. So in that type of manifestation that we call as a pittaja pramehas, and they are yapya in nature. Similarly, when there is kaphaja pramehas or pittaja pramehas which are not given proper treatment in time, or some persons due to some bija dosha or some other issues, if directly vata is involved along with the kapha, then there is a prameha that is called vataja prameha. This vataja prameha is asadhya in nature. So we should be very, very clear in understanding kaphaja pramehas are, we can keep it them in the stage of pre-diabetics, where it can be reversed by using various techniques and medicines and food. And yapya is such type of a pittaja thing that we can control it to keep it under certain boundary or normalcy. Whereas vataja is very difficult to control it as well as cure it. There's no question of curing this. It is always try to control it, because very clearly acharyas have kept this prameha as one of the astamaha gada, and it is a lifetime disease. Once it is there, of course, it can be controlled only if it is, and reversed only if it is kaphaja. So it is not a right understanding that vata is involved or responsible for the formation of prameha or diabetes. One of the variety wherein we have hastimeha and madumeha, all these come under vataja variety, what we call it as. That is asadhya in nature. That is not possible to control or cure or to give some relief in these conditions. So only we can manipulate and try to give various interventions can be done. Ahara, vihara, and actually physical activities and everything. Manipulation of all these things will lead to some sort of relief. And Vataja, reducing drugs like Bittergourd and all those things, that have been, it is going to increase the Vata. We need to understand certain thing. If a drug is said as Vata Hara, it doesn't mean it totally quenches or suppresses the Vata to every extent. There will be peculiar some lakshanas in that particular drug, and that will be again as particular guna in Vata dosha, and thereby it suppresses only that one, and remaining portion remains same. So that is the reason we cannot expect that every drug, if it is Vatahara, means it will be totally suppressing Vata. No, some may be suppressing the Rukshata of Vata, some may be suppressing the Laguta of Vata, some may be suppressing the other qualities of Vata, like Chalaguna of Vata, something like that. So based on those characteristics, then Vatahara, we call for every these type of activities Vatahara. It is true to some extent it is Vatahara, but doesn't mean it is a wholesome, totally it will reduce all the qualities of Vata. No, it is not like that. So we need to understand these differentiation, that even in a drug also, for example, there may be certain drugs which by virtue of their rasa, they'll be acting something different. By virtue of their guna, it will be acting something different. By virtue of their vipaka, it will be acting something different. But as a drug as a whole, when it is acting, may not be in contrast to one another, they won't drag the thing. There will be a wholesome effect of the drug onto the body. Certain important lakshana or a dominant lakshana that will drag the things to in its way. For example, in case of a pippali, pippali is a very katu padartha. We know that it is ushnavirya, but still it is having madhura vipaka, and that madhura vipaka helps in the formation of vrishakarma or the manifestation of vrishakarma. But it's a katurasa and ushnavirya does not come in the way of vrishakarma of its madhura vipaka. So these to be understood. This is the complexity of the terminologies and even the method or how our Ayurvedic drugs work. So you need to understand these characters.
And also, while understanding disease and its types, a disease will be there with its specific samprati and samprati gatakas. A disease will be having its own causative factors. A disease will be having its own nidanas, purva rupa, rupa, main doshas involved, and the subtypes in Vataja Prameha, Pittaja Prameha, and whatnot. So these are to be considered as secondary doshas that are involved. Like you said correctly, if you look into the Prameha causative factors, Asya Sukha, eating whatever we want, irrationally, not taking care of our Agni or our body health. And there is Swapna Sukha, sedentary habits, always lying down, always not exercising. All these increase Kapha dosha. So primarily the whole of the Prameha or the diabetes starts with the Kapha dosha primarily. Involved adjunct doshas are to be given secondary importance, and the main dosha which is causing the disease should be given primary importance, as you have said, sir.
Yes, definitely. That's what the thing. Without the anubandha of kapha, you cannot expect disease prameha would takes place. So prameha is basically with the kapha, and anything in the kapha, if it is a dominantly, then it is a kaphaja. If it is a kapha only, then it will be reversible easily. When it is mixes with vata and mixes with pitta, then it is difficult to yapya to asadhya. These type of things will happen. And once, even though Kafaja Prameha is not properly treated and continue to do the Nidana Sevana further, then ultimately down the line a few years, then the patient may turn into Madumeha Rogi, or it may turn into Vataja with all complications.
And in the case of subtypes, as in case of Vataja Kasa, Pittaja Kasa, etc., the subtype dosha involved, as in example of Vataja Kasa, Vata is the subtype dosha involved. So there, that secondary dosha that is involved is targeted through anupanas. For example, if Vata dosha is there, Tilataila or ghee is used as anupana, and Pitta is there, Ghruta is used as anupana. So in that way also the secondary doshas are targeted, sir?
So definitely, but here in case of kapha, prameha, it is like that very typically, but it is not so in case of kasa. Kasa can happen with other things also. See, but without the anubandha of pitta, you cannot have a jvara. Something like there are certain diseases which very prominently is responsible for the manifestation of those diseases. But kasa can be even the vataja kasa, a very dry type of thing, only irritation, nothing. There is no sputum at all. So that type of things can happen. But of course, that is what our acharyas have given a wide scope of understanding the disease and making the combinations. They are very clever in handling these things. Even though same drug many a times, for example, haritaki only one drug, but it, with different type of anupanas given in different type of diseases, and even all the three doshas it will be suppressed. Either it will be given in some with gruta or some madhu or honey or something like that. So everywhere they are very clever in handling these things. And of course, anupana is one of the important concept. Very clearly going along with the suppression or samana chikitsa. So whenever we want to select a proper drug to give that drug a typical support, then we go for a very beautiful manner the combinations of anupana so that the drug spreads very rapidly in the body and gives a result.
Yes, sir. And moving on to the second topic, we just touched base upon the hormonal therapy in teenagers. Probably this issue is very rampant in Western world. So I mean, we got so many questions on that. I mean, somebody has written overusage of hormonal therapy in teenagers in the West. Women's health related to periods is so ignored. For all these issues, girls are given or they're put on birth control pills or intrauterine devices just in the teenage girls, even for as simple as acne, they call it as hormonal acne or cystic acne, and they put it on strong medicines like steroids and hormones. So when a teenager client comes and she's already put on these hormonal replacement therapy, it becomes a little bit difficult to tackle. So in one way, we had to start the Ayurvedic, protocol. With Ayurveda, we are trying to balance the hormonal imbalance, but there is already external influence of these hormonal replacement therapy tablets given to her. So how to go about this, sir?
See, very clear. When a patient comes to us, there will be very clear understanding, or there is some clear cut annoying condition. For that reason, she has come to us. In this case, there is a pimple or acne. She is unable to cope up with that. She went to a practitioner and they are given external hormone therapy and she is using that, but still it is not under control and she is not happy with the treatment outcome. So when in such a condition she has come, it is the first line is that convincing her with the basic principles of Ayurveda to explain her what is the reason why this acne takes place. A Yavana Pidaka is what is the reason for it and what is the dosha involved in and what we are going to do it and how we are going to manage it and what are the aharas, viharas that you are going to stop it or avoid it as a patya and apatya concept. So when these things are very clearly made to understand, then definitely we can take her for the Ayurvedic principles of cleansing the pitta as well as kapha, and thereby that all cystic acne and everything will be going down, and even the usage of proper rasayan panchakarma therapies like virechana, then followed by rasayana chikitsa. So there is no need of any external hormonal therapy at that very early age, and that too for that simple reasons of say cystic acne and acne and such type of things that cannot be accepted.
Yes, sir. First point that I understand is that patient should be taken into confidence that what has been tried has not been working, so we are going to try afresh. Like probably you said for virechana, probably it's tokvikara and rakta dushti is also involved, blood intoxication or blood vitiation with doshas. For a teenager, we would go with say mrudu virechana only, or how to go about that, sir?
So yeah, that depends entirely on the way we convince them. If they get convinced totally and they are ready to take up these things, and if already they have suffered from these conditions, they will be definitely getting convinced. And if any required is there, and then you can allow them to go for the peer-reviewed journals, some data. If they are having any scientific mind to study and understand, use them. Once that is there, then you can go for making them for a regular virechana itself. That will remove the vidagdha pitta from the body, and thereby that formation or easy or redness which is out coming out in the form of yavana pitaka, all those things will be reduced. So that can be done. Then afterwards, the blood has to be detoxified by using rakta shodhaka therapies and all those bitter principle drugs. And usually these teenagers will have a tendency of using lot of spicy materials they'll be eating. So on that you have to put a curtail on that. If you stop them to eat all these things, then definitely it will give them support. And of course, cleansing is also a very important one. If they are not ready for the proper panchakarma in that virechana, then simple with laxatives also we can get the results. But on a continuous daily basis, some laxative drug should be given. It may be a simple triphala tablet, otherwise sukha virechika dravya like trivritleha in small quantities can be given.
Deepti ji, you have raised hand. Do you have a point to add?
This is a very typical case with my daughter. She had acute acne all over her body, even back knees. So not only the face, even the back is affected, and it left behind quite a number of scars now. So her doctor put her on a strong antibiotic for 3 months, and which messed her up even more. So she had to stop it because it became painful even to move because it affected her GI system. And along with her acne comes severe dysmenorrhea that she faints and falls down, like acute pain, like a labor pain for 4 days. So they have suggested me to put her on birth control, which I have not done yet. And at this time, like today, she has it, and it is a nightmare for my husband and I to we don't know what to do with her. So, what do you recommend I should do? Because she is Pitta Vata and she's petite, doesn't eat well, and she has typical teenagers thing. And also, she is in 12th grade, so a lot of stress because she has to apply for colleges now. So, lack of sleep, acute, extreme stress of picking up college and everything. So, what do you recommend I should do with her?
So with these history points, it is my suggestion is to go with Hingvastika Churna with combined with Sukumara Grita for the purpose of severe dysmenorrhea. First of all, we need to start it on the 21st day of the cycle till the 31st day. So if it is your daughter's cycle is going in a regular manner of 28 days to 32 days, that is one point. If you do it this one continuously, then automatically the things will settle down and the pain will reduce. The one point number one. Second thing, you need to add on a regular virechana type of material. For that, you can go for a small dose of Trivritleha, or you can even go for a capsule of Triphala regularly. Or even if you have Anulomana Churna tablets, that can also be helpful. So if it is allowed in a regular manner, daily, when the stools are passed, it should go with little bit of watery content, and regular virechana should take place. If that is things are happening, then slowly these things will be cleansed, and then you can add on to that Gandhaka Rasayana and Mahamanjishtadi Kashaya. That will definitely control the Ushnata in the Rakta and thereby avoids the formation of acne. So all these things are, and even that is good for the even the back as well as in the all these places wherever the acne is there. So acne, if it is increased, definitely it will cause this type of acne even on the shoulders and on the chest and the back and everywhere. It is very common, and these things can be even categorized under even sometimes it's a folliculitis and all these things. All these things are happening because there is an increased pitta as well as rakta is getting vitiated, and because of the food habits and sleep disturbance, stress and whatever it is. So overall impact, and of course of the age, they have an influence of pitta in that particular age. So all those things are contributing to our condition. So we need to suppress the pitta vidagdata in such a sense that by using Gandhaka Rasayana regularly, Mahamanjishtadi Kashaya, which will detoxify the blood, clean the blood, and regular with evacuation or the Sukhavirechana type thing by You either using either trifla capsule or by using Sukavirechana Leha or even Sukavirechana Churna, something like that, or Trivrit Leha or Hrudvirechana Leha. So all these things are similar with terminologies. It can be used. Then, of course, with the 21st day to 31st day, you can go with the combination of Hingvastika Churna and say about 3
Sukumar
grams of
Grata.
Hingvastika Churna with 5 to 10 grams of ghee, Shukumara Grata, on empty stomach in the morning as well as in the evening, twice a day. If these things are done, definitely it will, within 3 cycles, her pain and dysmenorrheic conditions will go down drastically. So this is what we can do it.
Sir, what should be the doses for Gandhak Rasayana and Mahamanjishtadi Kashaya, please?
If it is her weight is somewhere between 50 to 60 kgs, then we can go for a standard Gandhaka Rasayana 202, 2 tablets in the morning and 2 tablets in the night.
Kashaya will be okay if I give 10, 15 milliliters?
Kashaya, that's once again which company you are using. Based on that, if it is totally watery, then we can go for up to 15 ml. If it is little bit thicker, then it is better to go with 10 ml. 10 ml twice a day or 15 ml twice a day. That depends on the thickness of the kashaya, because there are companies with kashayas, Astavashesha, Padavashesha, Ardhavashesha. There is a method of preparing that. Based on that, there will be changes in the strength and thickness of the kashaya. So that accordingly we can adjust the dosage. It may be 10 ml or 15 ml per day, per dose, twice a day after food. If it is before food, then also good, but may not be, many patients may not relish it before food. So that's why I usually suggest to go on after food.
Sir, most of these patients are very thin. I have noticed that they are mostly Pitta and Vata, or
Yes.
Vata or Pitta girls. I have yet to see a Kapha girl having this problem. It might be happening to girls with the Kapha Prakriti, but why does it happen to only small, petite, thin? Or is it that age all the girls are very thin?
No, it is not like that. Yavanapidaka can happen to anyone. It may be even the males will have, even the females will have at particular that age when there is a hormonal changes are they taking place. And usually those times they also have peer pressure, and as well as they have got their own type of food eating and all those things. It may be even in India or in US, that type of influence will be there on their food, and of course their sleep pattern, everything will be of that nature. So
No, I was
definitely,
talking
because
about dysmenorrhea, sir.
even for dysmenorrhea also, even for the
Okay.
dysmenorrhea also, of course, dysmenorrhea in that case, if it is not only for the thin girls, it can even happen in very fatty, obese girls also. It may be different way of things. It is no, just not because of Vata and Pitta in their Prakriti that will be. No, Prakriti is only to analyze whether it is supports the condition or not. Many a times the disease will be there, that disease won't support the Prakriti. So our intention of understanding Prakriti in any patient is just to know that whether the Rogabala is more or not. As you said, if it is a weak and thin personality, develops this type of thing, then the intensity of the Roga will be more. Whereas the same disease can occur in a patient with a Kafaja Prakriti, then the intensity of the disease will be lesser. That's the reason that we want to go for the understanding of Prakriti of a person.
And especially with the teenage generation, they are into drinking soda, aerated drinks. I'm not talking about this particular case in general. And they have this weight consciousness, so they'll be eating less amount of food. Their lifestyle is a little bit haphazard. So correcting diet and lifestyle is so very important in bringing back the hormonal balance as well. So.
See, in each and every case, you cannot have a tailor-made question and brochure for all these things. Whenever a patient comes to us, it is our duty to drag out the information through Prashna Pariksha. We need to put a large number of questions based on the condition. It may, if a person is lean and thin, still develop something. If a person is fat and still develop a condition, then we need to assess that why it's happening, what may be the probable nidhanas. So then we need to understand in such a sense. Then we need to give questions or leading questions or sometimes multiple choices and all these things, and try to get the information. What may be the probable reason? You need to ask whether you are doing this one or doing that one. Then they will give out them. Then ask them if anything you want to tell me that it may be the reason for that. Like that, we need to give them a lot of scope so that they can come out with something which they might have not told to their parents, something like that. So all these things will come when we go for understanding a case. So when all these lakshanas are lined up, then we can, as a treating physician, we can analyze which dosha is involved, whether it is vata, pitta, kapha, or combinations, or all the three doshas, sanipataja, or samsargaja, something like that. So when we can understand this, then accordingly the further treatment protocol can be done.
Like you said, after the thorough interrogation, putting open-ended questions like, "Am I missing something?" or "Do you want to say something more regarding this?" or "Is there anything that you want to tell us?" So sometimes the patients will be eager to tell a thing, but they'll be, because of the question and answer, that interrogation is happening in a different line, they may be a little hesitant what the doctor may feel. So that little hesitancy might be there. So putting these kind of open questions and taking the patient into confidence really makes them to open up and tell it all. That's so very important for digging out the nidanas, causative factors.
Yes, once we come to know that what, because in the therapeutic aspect, if you observe that what is our principles of therapy says, the first thing is nidhana parivarjanameva chikitsa. So nidhana parivarjanameva chikitsa means removal of the nidhana itself is the first line of treatment. So in that sense, if you are talking about, then we need to understand what may be the probable nidhana in this case. So each and every case we need to understand in such a way that we need to dig out the certain priorities, and we need to drag the information from them. So then probably we may end up very close to the nidana, and sometimes very pinpointedly on the nidana, so that we can avoid it.
And this Mahamanjistadi Kashayam, it's a wonderful combination with neem, turmeric, daruharidra, triphala is there, kutki is there, patola is there. So it's a very good combination to address not only skin diseases, but almost all conditions involving rasa and rakta dhatus.
Yes, definitely. Mahamanjistadi is useful for all the, particularly in very specifically for the Rakta Pradoshaja Vikaras. In any Rakta Pradoshaja Vikara, Mahamanjistadi is one of the things. But usually in our scope, there are still many drugs are there. We can use it, like Aragudadi Kashaya is there, Patola Kadruhinyadi Kashaya is there, Gugudutikta Kashaya is there, Mahatikta Kashaya is there. All these things are depending upon what type of doshic involvement, what is the lakshanas, and accordingly we can go for it.
Okay, so moving on to the next topic. There was a question like, can Shatavari Ghuta be given to debilitated young girl, or does it induce early onset of menarche? I think we have already answered this question very elaborately, so let me skip that. Coming to the next topic, this is question has just come. Living with people who radiate the energy of discrimination, anger, rage, silent negative treatments, and other mean behaviors seem to have a great negative effects on the people in a household. Would you talk about the negative energy in one's environment? So this can happen with the parents and their children, parents being negative in those cases affecting the this one, and it can also happen in relationships, meaning husband and wife, spouse, or a live-in relationship, boyfriend, girlfriend. One might be overpowering, and that may be affecting, or bad habits, alcohol abuse, or even it can go up to physical abuse as well. So very soft topic when such a patient comes and when we are interrogating to get the details. So.
See, this type of topics, what I usually do to my patients, if anything of that nature comes, I will straight away ask their basic question: what is your relationship, or husband and wife? Why you are still husband and wife? If you want to quarrel, or if you want to fight like this, or do some type of nonsense. Our life itself is a adjustment. We are here in this world. We need to adjust certain things. If you are having any trouble with your husband, straight away tell him, and he should also have a broad mind accepting that. And if he has any trouble with you, he'll be explaining the things to you, and you should be having the courtesy to accept it and rectify things. If such behaviors are there, there'll be no question of negative energy in the house. The house is made by the minds and the people. It is, if you are in the same house with just like quarreling with each other and having some negative energy, it's of no use. It is better to get divorced and get separated. If it is to be in one house with, you want to enjoy the life with companionship and you need to enjoy all these things, then you need to compromise certain occasions. And understanding a person and in totality and accepting a person in totality is always a good, and that gives a lot of positive energy. And with just because of something we are being just lagging behind, and just somewhat the reason we are just going with him, and it's my majburi or something like that. No, I cannot leave him now, all these things. Yeah, I got my own troubles and problems. So many ifs and buts. If such type of things are there, it is better they need counseling rather than a drug. They need to be sit together. They should be come to a clinic, and the doctor should take their history, convince them where they are making mistake. And if both they have the intention of to keep the marriage or the keep the relationship alive, then that can be done. So if anybody is passing out negative energy, it is once again my perception that how to understand this negative energy. Your husband and wife, and husband is just giving negative energy to wife, then where is the relationship, where is the love? So it doesn't mean any sense in such relationships. A relationship is always with lot of emotions, understanding, commitments. If that is there, then no question of any negative energy. Negative energy should not be there.
Yes, sir. And just today, Sadhguru has quoted this wonderful quote: "People who logically examine their relationships cannot sustain them. Two bodies, two minds, two emotions can never fit perfectly. Magic of being together can never be contained in logic." So, whenever we are working uh, as a team, so we cannot logically say that okay, she has ABC qualities and we have XYZ qualities, so we will match. So it's not like that. And Steve Jobs was giving a perfect example on Beatles. So in the Beatles music gang, all the four were kind of a mediocre people, or I'm sorry, not mediocre. I mean, they were having their own talent, but when they were coming together as a band of four people, the magic was happening on the stage and in the studios. That's why they were like so successful. So the combined effect of husband and I, wife or partners. So that is something magical and that cannot be explained by logic. So,
See, that's the reason we need to have some relationships. See, we are in this world, and we will be under the guidance of parents, and we will be there up to somewhere. And once we want to enter into a relationship, then we should have that mindset and understanding that what should be accepted and what should be conveyed and how to convince, and all these things should be there. It is just like simply just I will just dictate everything. No, that will not be. Yeah, of course, even certain times, even that also happens. If somebody is a dictator type of mentality, the other one is submissive type, then that their combination also runs years together. But it is better always both husband and wife are in a family, both should be convincing, and both should give the credit to both emotions, and both should go together. Then only the life will be with real music. Otherwise, it is a difficult task.
yeah, sometimes I mean we may find fault in the spouses, though we are quite similar, or it is not about opposite qualities or similar qualities. Even if both are very similar in their thinking and all, maybe the color of the dress that she wears I do not like, or maybe how I talk she doesn't like. So it all depends on how we gel well. And also we as Ayurveda practitioners, we really do not know when we have to switch to counselor and really understand their problems, go deep into the discussions, and get to the bottom of the problem and convince them and all. For that, we should also have some kind of a spiritual energy, or we should be reading a lot and understanding the spiritual principles and all. At least the Ayurveda textbooks we should be reading and understanding even the social and interrelationship aspects. We should be understanding and we should be ready for that, because general consensus or general notion is that if they go to allopathic doctor, they will just prescribe medicines and send off. But with the Ayurveda doctors, only usually they hit into a conversation and all these minor topics come into foray.
Usually like that only. Whenever that's what the entire package of treatment goes in such a sense that whenever a patient comes to us with these things, we try to find out the nidana, then lakshanas are matched, then accordingly, then we plan out the protocol. In that protocol, we always usually any sort of diseases, we try to give them what is pathya in ahara, what is pathya in vichara, what is pathya in vihara. Everything we'll give which is good to you in this condition or for your body type, something like that. So we try to give them a list of things which should be done and a list of things which should be avoided. So that is a very real way of giving things, not just simply by prescribing some medicines or something will go. No, not always will get the result in that.
Like you told, I mean, we should give them, both husband and wife, to do tasks, maybe play carom together, or go for a walk together, or do not comment on that particular issue which is bothering. So we have to give them kind of these to do tasks, and we have to give them chance to kind of recover and gel well. It's not like I mean, month by month we have to, it's not like we are just advising divorce all of a sudden. Because there's a question, when can we suggest separation when we see such toxic relationships as a vaidya? But whatever may be problems, we should give them some time and chance for them to come back. So.
It is easy to ask them to go get separated. It is not a big task. It's very easy. But you just convince them in such a manner that give them ample of time, let them sit together and try to convince them what is the importance of companionship, what is the requirement of you or what is the requirement of her in your life after 10 years or after 20 years from down the line. So everything you need to understand this. How this later when your children will go away from you, you are dependent on your husband and her husband is dependent on you. How you should go together. These are all the things. Because they will be quarreling looking at the present situation. They are not looking at the future. So there will be certain type of things and conversations and counseling part of it that all should be done. If it is still required, then we can. There are professionals who can go for the counseling type of things and the marriage counseling type of things. Then we can send to them. Later, if they are still having some problem, it is up to them to finalize, and they have got legal people who can help them to get separated.
Yeah, probably referring them to a counseling center is also very important. Sometimes the problems may be so deep that we may not be in a position to decipher the whole problem. And professional counselors are trained specifically for that. So referring them to there makes so much sense. Moving to the next topic. So a healer in Spain has mentioned that this vaccination has negative energy. People who have this vaccine jabs have reported feeling fatigued, angry, and have noticed headache. Would you discuss about the change in energy in people who have had the jab? What are the medicines to be used? My first point to see is that wherever possible, we being Ayurveda practitioners with a scientific attitude should not limit our thinking to just negative energy. We should go deep and why the fatigue is happening, why there are specific side effects, and break down into Ayurvedic pathology or Ayurvedic terminologies and go deep rather than just limiting ourselves to just negative energy concept. Sir?
So definitely, see, after a vaccination or something like that, very clearly they have said it will have some sort of effect. And actually in the vaccination, what they are giving, They are giving the same disease causing nidhana in a damaged way or in a less potent way, or it won't cause a blown out disease. So same nidhana is being given directly in the form of a vaccination. That is was the concept. That is a concept in vaccination. So when you give nidhana to a body, definitely we need to understand there will be some lakshanas produced out of it. So when we are giving a vaccination, it is either attenuated or killed material which is causing the same disease. So when such type of things are given, definitely it yields a certain lakshanas, but that lakshanas will not go into a blown up disease. Usually, generally, it won't go like that. So after that, certain maybe 1 day or 2 day, the lakshanas will automatically reduce, and certain interventions of a simple medicines can also reduce the conditions. So in this, it's not negative energy. It is the change which is happening because dosha samurchana which is happening inside the body because of the nidhana. So it is not the negative energy there. And what the after the jab, the person is getting headache, body ache, and all those things. Of course, there are some issues with that. That disease is there. Of course, there are some certain occasions where after the vaccination, particularly this COVID vaccination, the people have developed clots in the blood vessels somewhere down the line and such type things and headaches and will related to that. We have seen all those such type things. There may be some subtypes of persons will have that type of things. So that should be they should be kept under observation, and blood thinners are given in order to overcome that clotting type of effects and all those things. So we need to understand this whole concept of that in that reality, and accordingly we need to treat. Just don't simply think it's only negative energy or positive energy. It is not like that. It's not so superior. I mean, so not so simple.
Generally, we should be open to scientific thinking and should not have opposing qualities or animosity or treating the other medical sciences with suspicion. That's not very good. It can be allopathy or yoga or naturopathy, whichever. We should have some amount of respect, and we should be thinking why they are doing what they are prescribing and what.
Definitely. See, we should have a rational thinking and we should be scientific in nature and we should understand the science behind every techniques and adopted materials or the methods. And we try to give an explanation to what our acharyas or why they have considered these things. Similarly, there will be a lot of research and understanding will be there before they come out with certain medication or something like that. We need to understand the basic principles of those sciences if you want to understand it really in the sense of what they are doing. So definitely their interest is also for the benefit of the mankind and our interest is also benefit of the mankind. And they are good at certain places and we are good at certain places. They may be good in acute conditions. We are best in chronic management and disease management. Then definitely. And our aim of Ayurveda is not to treat the diseased person first, but in order to keep the health of a healthy person is the first priority. So we all have a such type of our own priorities and aims and directions. So accordingly, we have to work up in the field. We should not simply criticize the other system. It is not a right kind of thing for a scientific brain.
And before we go into the next topic, ever since we have been sitting here for the last 22 sessions, including this one, my thinking on patient approach, my thinking on choosing the right set of medicines, that has got fine tuned. When I write a prescription and take a look back at what I have written, I always think back whether Gurubodha sir would be proud of this prescription, or would he change it, or would he beat me with a stick? Or it's totally he would totally disapprove. So thank you very much for bringing that, sir. I mean, medicines are there, treatment, chikitsa, all those things are there in Ayurveda, but bringing the sense or digging out the underlying principles, grasping the disease with its roots, and also thinking deeply on the choice of medicines, choice of herbs, where to give which herb to which type of patient, to at which age. We are learning so in detail just because of you here.
No, it is only just because what the Amshamsha Kalpana is told in Acharyas in the classical text and how they have done it. And see, now we have got so many support from the other system of medicines and the science, technology, and all those things to understand. Like we are using ultrasonography, we are using X-ray, we are using blood test, and so many things to understand the disease. But in those days, even without all these things, our acharyas able to pinpointedly concentrate and say this is because of this, and ultimately they used to give a combination, and the result was there. And of course, still just 400, 500 years back, the allopathy was not there, and everything was like it's a primitive medicines everywhere. What they call native medicines or alternative medicines, what presently we call them. These were the leading things, and with that, humanity has come down all these years. So definitely, it has its own role to play, and Amshamsha Kalpana is the one important aspect that we need to understand. Accordingly, pinpointedly, any lakshana, if it is annoying or very prominently seen, you observe it. Accordingly, understand whether it may be because of this dosha or whatever it is, whether avarana is there or direct involvement is there. Just little bit of churning will definitely give an insight and a proper mode of understanding the disease. And accordingly, of course, a selection of a drug comes from by choice and the confidence in the drug and the company and the product and everything. Of course, in a due course of time, that will be becomes a habit of choosing the right thing, and automatically it sets in. But doesn't mean that in everything that will be there. Even after with all these experiences, if you are writing it, in certain one or two cases, suddenly first 10 days the result as we expected may not come. Then we need to once again retrospect what you have done, whether it is right or wrong, or whether I need to alter my prescription, whether to change it, whether to fine tune it. All these things should be done with the help of patya or even with the anupana changing or by combination changing, something like that. We need to understand, or we need to adopt that those things.
Thank you, sir. And moving on to the next topic, this is a question. Can you talk about different kinds of cancers or other illnesses which have root cause in mind or stress? Can you give an example of particular mental disturbance resulting in a particular disease? So we have got lot many diseases, physical diseases, which have got their root in stress and mental components. Asthma, obesity, diabetes, headache, gastrointestinal problems, irritable bowel syndrome, even Crohn's disease, even Alzheimer's disease also has a component of stress. So, while deciphering any physical disease, we should also be giving a deep look on the underlying stress factor also, sir.
Definitely. Nowadays, most of the diseases are turned out to be psychosomatic in nature. We need to understand both the components, and of course, give a lot of counseling is also required, and of course, a drug selection and patya correction of those habits. And for example, they may be eating some viruddha aharas that we need to be understand, and we need to stop them, or something like that. We need to just by history. That's what the Prashna Pariksha, Darshana Pariksha, and Sparshana Pariksha. These are the three modalities through which we can examine a patient. And of course, in Ayurveda, Prashna Pariksha is a huge area with a lot of questions we usually put to the patient to get the information. And definitely, we get the information by questions, and we get it back as a feedback from the patient, and accordingly we can analyze the things and we can put it to in a right manner. And of course, a component of stress is there everywhere in every disease. And of course, when the patient is in disease condition, he is running to doctor, and automatically the stress factor might have even increased. I have seen many a times the patients, when we take up the BP or they check them, their heartbeat and BP will rise, and they will say that because you are examining and you are taking a BP, that's my BP is rising. So these type of things are very common. We need to counsel them, and we need to give a solace to them, talk to them very politely, and convince them, and say that unnecessarily you are taking too much of stress. Leave this, leave that. So all those things will definitely, to a certain extent, will help the patient to come over that. And component of psychological factors are even thing in the tumors and so on. As we know that cancers and these things are not the simple causative factor one or two. It is a multifactorial. So there will be certain nidhanas which are from the ahara, certain things are from vihara, certain things are from vichara, and even the certain nidhana is from bija dosha. There may be some hereditary factors involved in that. So cancer is not a simple one with a certain simple type of nidhanas. It will arise out of it. No, it will not be. It is a disease itself is a complex one. definitely the causative factors are also complex one, and they involve the both physical as well as the somatic conditions. I mean, involvement will be there.
To dig out the underlying stress, I mean, as much as I've seen, disturbance in sleep or questioning regarding sleep gives some hints. If the sleep is, disturbed or patient is waking up very frequently, not due to go to washroom and all, but he is not enjoying his sleep, or sleep is very light, or sleep in the sleep he has a lot of nightmares, and in the morning he is not fresh. That sleep factor gives a lot of hint towards underlying stress. So,
Yes, definitely. Nidra is one of the important factor. Ahara, Nidra, Brahmacharya is the three Tridanda. This is very, very important in Ayurveda. We need to understand that. So Nidra has its own supporting factor, and it is cleansing as well as rejuvenating one. When Nidra is lost due to unnecessary fear, you observe that where the stress component has come from. Stress has come from the fear of failure, fear of something like that, fear, all these things, a fear of getting ridiculed, or a fear of something like that, fear. With that fear, negativity, you will get a stress. Once you start feeling that whoever think whatever it may be, I will do the way I should live. If you start thinking in that direction, totally things will settle down. You'll never have a stress. We always think that what others will think about us, even that portion also you want to think, then what is the others has to do? It is their duty to think about you. Let them think. You just enjoy the way you want it to be. So once if you are going in that direction, nobody will or nobody will can give you stress. So it is the way we take it. The stress is there, but it is only applicable or causing trouble when you take it. If you don't take the stress, the things will not be on you.
the other day I was compiling on the various references for Bhaya in Samhitas. So it is told as Dharaniya Vega, meaning Bhaya, Krodha, all those things are explained as Dharaniya Vega, meaning whenever we have fear or anxiety, we should make all efforts to suppress it. I mean, we should overcome it. I mean, if we give the strength, then it will overburden, and it will become all powerful, and it will start, guiding us rather than we controlling our emotions and our courage. So only way to tackle fear or tackle anxiety is just being face to face and being upright and being courageous.
See, one is that type of fear. Second time, if you are such a natured person, suddenly a patient has fallen and there is a bleeding and people are carrying that fellow to your hospital, and suddenly say, doctor sahab, kuch karo. So everybody will run in that situation. If you feel that, oh, what can I do? It is bleeding. Then in that sense, if you approach to a condition, your mind won't work and you won't give you any relief. In those conditions, you need to understand that what should be done to rectify the things. So how I can save the bleeding, stop the bleeding. So such way of thinking. In similarly, when in a personal ground, if something comes as a stress factor, then you need to take that countering, that how I need to overcome this stress. So if you overcome the stress, automatically things will be settled down. And once or twice you just have a positive, fruitful outcome of this situation, and then automatically things will settle down. But the failures of controlling these things many a times will trigger out. And the meanwhile, that last time failures, previous failures will haunt you, and that will once again cause a trouble, and it increases the further stress. So we need to understand that factor. Keep cool. Whatever so happens, it happens. And whatever is happening, it is not just because of me. There are so many factors and influencing forces in the universe. They're all responsible for the things. So if you keep like that, open and understand and accept the truth, then automatically the stress factor will reduce.
There's a famous spiritual quote, I forgot from whom. It says, "Never be surprised by anything that happens to you." It's very difficult, and sometimes we all get emotional and all those things. But overall, we should remember that there's nothing surprise in life. Everything, like the other day, we lost the Chief of Defense Staff, Honorable Bipin Rawat ji. who was such a good man, dharmic, religious, courageous, leading the army in the front and developing future strategies for defense for India and all. Suddenly we lost. Life is full of surprises, sometimes positive and sometimes negative, but we should be ready for anything and everything, and never be surprised. Take everything in our own stride.
Definitely, we should always keep the things open and let the things come and accept it the way it comes. If possible, what rectification measures can be done, that will be done. Otherwise, accept it and treat it as it is, and accept it the way it comes.
Usually, I would ask, like, regarding sleep, it gives a hint, and I would ask questions like, how is your work going? Is your work manageable? Are you enjoying your work, or are there any stress factors there? Or do you get occasional headaches? Sometimes headache-related questions give out some tips or some leads on the underlying stress. And how is your relationship going? So all these probing questions sort of open up the patient to reveal about any stress underlying.
See, we cannot quantize the level of stress in that sense. It's only just to understand whether the person is having stress or not. For that purpose, we need to ask the questions because it entirely depends on the perception of what that fellow has. If a person is working in a company for somebody for a certain amount of salary, if he is not happy with that salary, he will try to find out the problem with the senior fellow every time, on every occasion. Even though the senior may not be doing any wrong with him, but still he has a problem with the senior because his own perception in the life and his own situation, and he feels that being this fellow and this much of qualified, I would have been in his place and he's there and I am still down the line, something like that. So these type of understanding and perceptions in the life will definitely leads to the stress, and such stress you cannot quantize. It may be a huge, maybe sometime it may be a very small stress, but stress factor is out of fear or because of the remembrance of the failures or negativity and feeling of that I could not do that, I'm still down the line, I would have been somewhere in the up on the chain. So all these things are always causing a trouble. Accept the situation how it is. Look at the people who are still down your line and feel good that you are still up above them. So that type of understanding the life is always good.
With those positive thoughts, it's time to end this session. Thank you all the participants for your interactive questions and making this more interactive. And thank you, Guraja sir, for your valuable inputs.
Thank you for all the audience.
See you in the next Sunday. Namaste all.